Hello, Dr. Drake. Good morning.
Hi, Dr. Lee. Good morning.
I want to discuss our patient admitted yesterday. How are you finding their condition?
Thank you for reaching out. I've been closely monitoring the patient's progress since admission. Initially, they presented with a high fever and respiratory symptoms, which led me to suspect they might have a respiratory infection.
I see. In their medical history, the patient has had a history of asthma. Have you noticed any exacerbation of their respiratory symptoms?
Yes, I have. The patient's asthma symptoms have worsened, and they required bronchodilators to relieve their breathing difficulties. However, I also suspect there might be an underlying bacterial infection since their fever remains elevated despite receiving appropriate antipyretics.
That's concerning. Given the patient's symptoms and medical history, it might be wise to conduct further tests to determine the cause of the infection and assess their lung function. I suggest ordering a chest X-ray and a complete blood count with differential.
Agreed, doctor. Those tests should provide us with more detailed information. Additionally, I would also like to assess their oxygen saturation levels using pulse oximetry to ensure their respiratory distress doesn't escalate further.
Great suggestion, Dr. Drake. Monitoring and management of the patient's asthma are crucial to prevent further complications, especially considering the added risk of respiratory infections. I'll make sure to consult with our respiratory therapist to optimize their current treatment plan.
Excellent, doctor. Collaborating with the respiratory therapist will help us tailor a comprehensive approach for the patient's respiratory care. Let's also keep a close eye on the patient's vital signs, fluid balance and symptoms progression to ensure we don't miss any changes that may require immediate intervention.
Agreed. Continuous monitoring is key, and I will make sure to document all relevant updates in the patient's medical record. Regular communication between us will help us adjust the treatment plan as needed.
That sounds like a solid plan, doctor. Thank you for your insights and collaboration. Let's continue to work together to ensure the best possible care for our patient.
Thank you, doctor. I appreciate your input as well. By working as a team, we can provide the patient with the highest level of care. If any significant changes occur, please don't hesitate to reach out for immediate assistance.
Certainly, Dr. Lee. Patient care is our top priority, and I'll keep you updated promptly. Let's remain in close contact throughout the patient's stay.
Thank you for your dedication to this case. I look forward to further collaboration in the best interest of the patient. Now let's go for meeting.
Yeah. Let's go.